Some people say the metaverse will only be virtual. But one day in the metaverse, doctors will practice high-risk surgeries hundreds of times before they operate on real patients. And students will be transported to ancient Rome and Saturn's rings, improving health outcomes, learning, and more. The metaverse may be virtual, but the impact will be real. Learn more about what Meta is building for the metaverse at meta.com/metaverse impact.
Highlighting stories that hit close to home, from your borough to your dinner table. This is Carter Cares.
The situation at Rikers Island and how do you deal with it? Joining us now is Mr. Stanley Richards, who is the Deputy Chief Executive Officer of the Fortune Society, an advocacy nonprofit that helps people and helps prison inmates upon reentry back into society. He does a lot of great work. Thank you for joining us.
Thank you for having me, Dominic.
Of course. So the numbers are staggering and serious. In 2021, 16 people died while in the care of the Department of Corrections. And so far this year, we are outpacing that, where 11 people have died in the custody of correction. That's not just Rikers, including 2 in the space of a week in July. Why is this happening?
It's a very sad situation. You know, I was first deputy commissioner at the New York City Department of Corrections, and I can tell you every death that we experienced was a tragic and horrific situation. People are detained into the custody and care of the Department of Correction while they get their cases adjudicated. It is the expectation of society and the rules of our laws that says that a person is presumed innocent until proven guilty. And many of the people being detained on Rikers Island have not been proven guilty of anything. They just have not been able to afford bail and haven't been released. And so we have a situation where our New York City Department of Corrections has really become an institution that deals with all of the ills of society. We see over 50% of the people who are incarcerated on Rikers Island have mental illness. A significant portion are homeless, have substance abuse, and all of the issues that we are dealing with as a Department of Corrections, as opposed to dealing with it by providing services and getting people the treatment that they need. And it is a perfect storm, a situation where officers aren't trained to be clinicians and providers. We have a system that was designed to punish people, and Rikers is not a place of where people serve long sentences. It is a place where people are supposed to get their cases adjudicated. And so it is a perfect storm of dysfunction. It's a perfect storm of trauma. And it is a perfect storm where the department itself just creates perpetual hurt. Officers hurt, non-uniformed people who work on the island hurt, people who are incarcerated hurt, and family members hurt. And it is time for us as a society to say enough is enough. We are not going to do it. What we've learned over the last decades is that we could have lower number of people incarcerated, safer communities, and provide alternatives for people to get the mental health services that they need, substance abuse treatment that they need, and access to stable housing.
Mr. Richards, let me ask you this, because you have a very unique expertise here. You served on the oversight board for the jail system. The Obama administration named you a champion of change, and yet you were also formerly incarcerated yourself. You and I are each natives of the Bronx, yes. And you spent 2.5 years on Rikers in the 80s before serving 4.5 years of a 9-year prison sentence. So from your unique perspective, talk to me, please, because I'm trying to understand what's going on about the solutions. How do we get out of the mess that we're in right now with Rikers?
Well, it takes huge investments, and we have to focus on the driving causes of incarceration, and that is some of our criminal justice policies we need to fundamentally change. We need to make community investments to allow people to be diverted and engaged in services. We need to deal with the mental health crisis we're having in our communities. We need to deal with the homeless crisis we're dealing with in our community, and we need to deal with the disproportional impact of economic or lack of economic opportunity in some of the hardest hit communities in New York City. At Fortune Society, we see about 9,000 people a year. Over 50% of our staff are people with justice impacted. 30% of our executive team are people with justice impact. And so we know if we provide the right services, we make the right investments, we can turn this around. Rikers Island doesn't have to be a stain on our city. It could turn around, but it takes huge investments, and it's not an investment over 2 years or 3 years. It took generations for us to get to this particular point, and it's going to take generational investments to get us out of it. We need to close Rikers Island. We need to build a smaller borough-based jail that is centered on the humanity of those who have to be detained, and for those who have to work there, we need to make sure that services are available to people when they're in there. And most of all, we need to make sure we're providing an off-ramp with intensive wraparound services for people who come into contact with the criminal justice system so that we could stop the cycle of incarceration.
So explain this to me, please. And we are talking with Stanley Richards, who is the Deputy Chief Executive Officer of the Fortune Society. Why are people dying within the system? Why are people committing suicide within the system?
When you are incarcerated, there are few options you have. One is either you're predator or prey. Two, you either go into survival mode or you go into hopeless mode. And when you see suicides and when you see massive drug overdoses, you're seeing the sense of hopelessness, the sense of things in my life aren't going to change, things aren't going to get better, and so why do I continue? And just like all of us in the community, every day we get up and we fight our way through our life experience. When you are incarcerated and you are isolated and there is no sense of people caring, there is no sense of connection to the community, you build a sense of hopelessness. And when people are hopeless, they go to the worst place. And they go to the things that they think will give them the most peace. And unfortunately, suicide becomes an option. Unfortunately, violence becomes an option. Unfortunately, drug use becomes an option because they are trying to escape the horrors of their experience. And so that's one of the reasons why we say we need to close Rikers and build the borough-based jails. Rikers is out of sight, out of mind. People don't think about it. It is a blip on the New York City map system. People don't hear about Rikers. They don't think about Rikers. But there are real lives, both from officers and from incarcerated people that are impacted by that system.
Well, Mr. Stanley Richards, I'm out of time for right now, but this is a topic that we must continue. And I want to have you back where you're starting the program and we can focus in great detail about Rikers, because your last response just really opened up my eyes to why people are taking their own lives and why there's so much violence. I guess I just hadn't looked at it that way. So I thank you for joining us.